Welcome to District Dialogue. I'm Commissioner Mitchell. Now you're probably wondering, why am I standing not only outside, but here at the Surgery Center at WellStar? I've got more to talk to you about a deadly disease that's killing many of our men here in Douglas County. We've got statistics, we've got a urologist, we've got doctors, and I think you're going to enjoy this particular segment of District Dialogues. So come on and join me. Welcome to District Dialogue. I'm Commissioner Henry Mitchell of District 1. And I guess most of you are wondering, okay, he's in a different setting. What is actually going on? And the reasoning we're here is we're at WellStar. And I've got a special guest. He's a doctor, and he's going to share with us a lot about a unique thing that I've had a chance to witness, and that is prostate cancer. Now, I'll tell my story as we go along throughout this conversation about prostate cancer and what my involvement has been thus far. How did I notice this? What procedures I went through? But I must say, I got to give kudos to WellStar for all the work they did with me and helping me get through this process. And this was a long journey, a very long journey. And my goal today is to actually make you, the District Dialogue audience, aware of this particular silent killer that I found out more about, and that is prostate cancer, and making you aware of how to get tested, what things to look for, and a plethora of stuff to kind of get you prepared for that situation that you may encounter. So with that being said, as I tell my story, I want to introduce a guest that I've got, and I'll let him do his introduction. Tell District Dialogue kind of who you are, your representation of this whole prostate cancer awareness moment.
Sure, thank you. Thank you so much for having me here on the show. My name is Dr. Ashraf. I recently joined the medical group at WellStar in Douglasville, and I completed my training at Grady Memorial with Morehouse School of Medicine.
And I share with you, I'm a Grady baby, so just FYI,
Wonderful,
that's a good thing. Okay,
yeah.
Well, go ahead.
And I'm very excited about my new position here, taking care of patients here in Douglasville.
Got it. So thank you, first of all, for coming on board and having a moment with our audience, our District Dialogue audience, and talk about prostate cancer. So, let's just kick it in high gear and talk about, a couple of big questions. My first question is, how do we alert the community on getting their prostate checked? And
Absolutely.
Okay.
It's a very important question. And I think before we go into that, it's important to mention the statistics. What are we looking at?
Okay.
Numbers are always good, and they put things in perspective of how important this issue is. For example, in 2018, there were about 165,000 new cases of prostate cancer in the United States. And of those, there were about 30,000 people who died from prostate cancer.
Wow.
That's a huge number.
Wow.
And that shouldn't be the case with the screening test that we have. We're able to diagnose it earlier, and that doesn't need to happen.
And that was a case in point with me, though. I had an opportunity to kind of go through it, and in my earlier years, it was more of the blood test that caught it versus the anal testing and all the other good stuff. But that's a large number, though.
That is a huge number, and you bring up a very valuable point. Well, if you look at the patients or individuals who are vulnerable or at risk for prostate cancer, you have your adult males, usually over 40, and these individuals are pretty much set in their ways, and having a digital rectal exam is not on top of their priority.
I know, see, I was ready to run a marathon, and when it all of a sudden came my way, which it was probably already there, but when they made it aware that you have prostate cancer, I didn't have any true symptoms. I wasn't hurting. I wasn't limping. Didn't have any urine, the blood in my urine or anything.
Absolutely. So you're like a typical case of early on prostate cancer manifestations. So you would not have any symptoms.
Not a one.
Yeah. So you were lucky and fortunate enough to have a provider or go to a provider and have this done with a blood test and which was further investigated with urology and
yes,
taken to
yes, biopsy and everything else,
yep.
and realize that, oh, okay, this exists. But give us some more statistics. I mean,
yeah, absolutely.
Okay.
Some of the other things that are interesting about prostate cancer is 1 out of every 9 will be diagnosed, males will be diagnosed with prostate cancer in their lifetime.
Wow. Got you.
Which is a huge number. Also, you will see about 6 cases in every 10 males will be diagnosed at the age of 65 or older.
Got it.
Okay, and as well as individuals from 57 to and the average age of diagnosis is around 66.
Okay.
That's the average age that the cancer gets diagnosed.
And what are some of the options that you have in the whole prostate, I guess, from surgery to, and I don't know, this maybe a question for you or not though, but is it surgery, from surgery to, what is it, chemo? I mean, there were several options that you can kind of go through to kind of hopefully to remove or take care of this situation that you may encounter.
Right.
What are those, any of those processes that we can speak on?
Well, yeah, so some of those things are really more involved. They're more the urology specialty questions.
Got you.
But,
Okay.
but I think what we can touch upon and I think give more information to the audience is, for example, the statistics here in Georgia.
Okay.
So I have some numbers that I would like to just
Sure.
mention and
Share
discuss with
us.
you. So in the state of Georgia in 2018, we had a total of about 5,300 new cases of prostate cancer.
Okay.
And we had about 870 deaths from prostate cancer, which is a really high number.
Got
If you look at our neighboring states in the south, if you go to Florida, they had about 14,000 new cases and about 2,200 deaths from prostate cancer, which is another huge number. Just quickly going to North Carolina, they had about 5,500 with about 900 deaths from prostate cancer. South Carolina had about 3,000 cases, new cases with 500 deaths. And Tennessee and Louisiana, Tennessee was about 2,700 with 6,000 deaths. And Louisiana with 2,600 and 400 deaths. Again, these are big numbers which can definitely be controlled if we do proper community outreach and and screening.
And most of this information, you're pulling this from the American Cancer Society?
That's it. That's the 2018 American Cancer Society website. Yep.
Got it. Well, interesting. So with that, what else do we need to share with the general population and the general public about this bug, prostate cancer? I mean,
I think one of the things that's very important is to make public awareness. Right, to have some sort of awareness campaign. Another thing is that we could definitely look into free screening. Okay, that's going to be a huge part of trying to get those new cases and making people aware that they have prostate cancers. And other thing is testimonials, similar to you, what you're doing. This is a huge part of this. Individuals who have gone through this whole process, like you can attest to yourself, are very key points and key aspects of this whole community awareness and outreach programs. And people like you or individuals like you can really bring this story to life. You have a personal connection to it. And we need more individuals like you who can come forward. And sometimes this is not the best thing. Remember, society has stigmatized cancer and people do not kind of want others to know that they have cancers, and I want to applaud you to kind of do that, and that's a great initiative that you're taking.
As I didn't know, had no idea about it outside of my physician just helping me through this whole process to make me even aware that you might want to go get tested. What are the signs? What should you look for?
So, like for example, for you had no symptoms of that kind of point to having prostate cancer. But some of the major things we'll just touch upon would be, let's say, for example, if you have any blood in the urine. That's something that's concerning. Let's say you have blood in the semen. That's another sign that is concerning. Another thing is if you have a slow stream, your urine stream is all of a sudden decreasing, or you're retaining urine. Those are all signs that point towards issues with your prostate. If you had prostate problems before and now they're getting worse, are additional risk factors or concerning signs.
And there are several stages. I mean, I'll just say from 1 to 4 or 5. Or whatever. So the extreme is 4 or 5. I mean, or
yeah. So again, those are I would have left that for the
The urologist.
The urology.
I got you. Okay, understood. Okay, I'll stay away from that. We'll leave that question for the next guy. We talked about, some of the signs for. What are the functionalities or anything that we can talk from that perspective?
Right. So just to look at the prostate organ itself,
okay.
To see where it's situated. Mm-hmm. It's a term that was it's a Greek term that means something that is placed in front. So it's actually in front of the bladder. All right, and its function is to kind of provide this fluid for the passage of the semen.
Right.
Okay,
right.
And that's what its main purpose is to do. And what happens in the case of prostate cancer is that you have these cells that are dividing normally, but they're out of control.
Got it.
And then you have different zones where this can happen, and depending on where it is, the symptoms will be manifested differently.
Got it. And these cells just continuously kind of grow and outgrow themselves, and I'm assuming that's the spread.
The spread of cancer. Yep.
Got it. Because I know, just from my experience and what I'm dealing with thus far, didn't have any slow urine, didn't have any true signs of, because like I said, I was ready to run a marathon.
Right.
And only to find that you might want to go and get this checked. And they took the PSA, and that was the blood
test. Yep.
The blood test, and came from that perspective and said, okay. Oh, and they did a biopsy. Yep. Explain the biopsy process. Okay.
Sure. Right. So let's say, for example, once you've seen your primary care physician or doctor, they did your PSA. It was elevated.
Yes.
Then
that's the right word. Elevated. Okay.
Yeah. Elevated. Yeah. It was higher than normal.
Right.
Then the next process would be to refer you to a urologist.
Yes.
Who would have to go in and do a biopsy. So, like you've experienced, the biopsy is done where multiple samples from the prostate are taken and analyzed to see if there's any cancerous growth.
Got it.
And in your case, that was true.
Yes.
Yeah. And then after that's confirmed, then you go ahead and different treatment options are provided to you. And depending upon what you and your urologist have discussed, you move forward and undertake those treatments.
And maybe a question for you or the urologist, what determines which of the options that you have? Well, would it be the stage that you're in?
Yeah, absolutely. Okay. So again, this all has to do with the stage that the cancer is diagnosed.
Okay.
And all things are looked at, the stage of the cancer, the spread will determine the treatment options. And discussion between you and your urologist will determine the course that you guys take.
Got it, because I end up doing the surgery.
Okay.
The robotic surgery.
Okay.
Okay, and did the surgery, went well. So far, so good. I'll do another testing in early January, February, and latter testing, and roughly about then determine kind of where we are and what that stage is. Sure. So I'm assuming in that particular process, they cut as far out, and I don't know what's the right terminology, that they cut far enough out to kind of capture whatever.
Sure.
Okay, go ahead.
Yeah, so what they will do is basically they would map out the prostate with the core samples.
Okay.
And then they would do, the urologist will be able to better explain to you.
Okay.
So they have kind of mapped it out, and then they will try to go as far where the margins are clean, where there's no growth, and remove all tissue within that area. So that you really want to get to that area that is growing abnormally, and just remove that out of the system. And then monitor you in the coming months and years of your PSA levels.
Right, because that's what's happening next in early January or so, is to look at that particular PSA level and see exactly where we are, and supposedly I'm assuming they're hoping that it's either -1 or 0 or something of that caliber, based on what they actually did with the surgery.
That's correct.
Wow. Okay. Good stuff. Any other statistics or anything else that we need to kind of cover just from awareness? And I want to make sure that we make sure that our audience, our District Dialogue audience, really understand the importance of being tested.
Absolutely.
I mean, making sure that if you've got your husband, you've got your uncles and grandfathers, and make sure that they actually go out and get tested, because this is important.
Absolutely. Yeah. To kind of increase that, add to your point.
Yes.
I think it's very important to look at what research has found. So there's a number of studies that were done to look at what is the proper way of outreaching to the community, and, and what the theme has come back, and what they found is that if you have three things that you address, you'll have a great outreach program. And one of the first things that they found was that you have to know your target audience. And in prostate cancer, it is the African American population. Prostate cancer is more prevalent in this population than others. So you definitely want to address that issue, that you have to know your audience. The second thing that they found was that the family members, the girlfriends and the wives, played a huge part in getting these individuals to getting the screening.
Got you.
All right? And then the final thing that ties everything together is having a provider, a healthcare provider that you trust, that you can sit down and discuss this and have a game plan in place where you guys do the PSA, whatever you're comfortable with, or the digital rectal exam, and then be prepared for the outcome, and then take it from there. And I think bringing these three things together will enable us to have a very successful outreach program.
Got it. And that's something I think as I get back in office and do what I do is to make this a journey of minds to assure that those that need to know. Because I feel like if I can reach out and capture at least one somebody who takes the test, who actually get out and do the right thing, as I would call, and hopefully help one somebody, will be a massive of numbers will multiply and help the community by being aware of this particular, as I've known it, as the silent killer of men.
Yeah, absolutely. So I think this is a great initiative. This is a great endeavor. But always remember that with any challenge that you're facing, it's never a sprint to the final result. We're not going to sprint and get everybody screened. It's more of a marathon. We're going to just pace ourselves. But at the end of the day, we just have to remember that we are human beings. And the target audience for prostate cancer are those individuals who really are set in their ways. And the goal here is going to be to identify these people. They're going to be your policemen, they're going to be your firefighters, they're going to be your athletes. But at the end of the day, it's about getting screened, and we got to get the word out, get the community involved, and definitely we have the treatment. We have, medicine has advanced, that the treatment is there. People who get diagnosed, treated early, live long, healthy lives. Of which you're going to be a prime example of. You got it.
I know when you spoke of earlier about the macho-ness of the males and how we feel and don't want to do the anal
digital rectal test.
That becomes a tough move to make, but if nothing more, with technology and with using the PSA or the bloodstream, that you can kind of take that test. Is that something that you should do when you go to your physician and say, hey, I would like to get a prostate test, but do you have to make that request of a PSA, or is it automatic that they'll get that message of what that is?
That is a very important question, and I think this is something that needs to be discussed. The way research has come about with prostate cancer, different organizations have provided different information. And therefore there's conflicting kind of research that shows the benefits and the risks of getting the PSA. So that's why healthcare providers have kind of taken a step back. What needs to be done here is it's individually based. If you're concerned enough and you fall within that category of above 40 years old and you're African American, or you have close family members with prostate cancers, you're at higher risk. So if it's those individuals, I'll highly recommend them going to their healthcare providers, discussing with them their concerns and asking for the PSA, and then taking it from there. And those individuals who don't belong to this category, it's individually based. It's up to them how concerned they are about prostate cancer.
So on a closing note, are there any things that WellStar, and I know you're newly on board with WellStar, are there any plans for WellStar to help orchestrate this awareness program when it comes to men and prostate cancer? Are there any plans that you guys may have that's in the future?
I think it's a great initiative. I think I have a firm belief that if you have a healthier community, you have a happier community, and I'll definitely try to pursue or make this make it awareness project and a topic for our leadership here.
Yes.
And I'm looking forward to maybe in the future, working together and getting the word out that, getting a PSA is very easy.
Yes.
If you're not interested in getting a digital rectal exam, that's fine. But we have a blood test that can give us a clue into what's going on.
Right.
And you could get it every year and just get it surveillance and catch prostate cancer early because the treatments are there.
Right.
And once you're treated, you're able to live a long, healthy life.
Well, that's what I'm expecting. So, I mean, they got me now for another 4 years, but I know I got another 104 years that's forthcoming. So, but listen, let me say thank you again. Sure. And I appreciate you sharing with the District Dialogue audience. Are there any closing remarks that you would like to share with our audience?
No, actually, I'm very honored and privileged that I got the opportunity to come on your show and discuss it. This is a very important topic.
Yes.
And it's very easy to kind of get tested and get the public aware of the situation.
Yeah. Well, as you know, it's personal to me,
yes.
and that's why I chose this particular topic. So again, thank you, and I appreciate you being a part of District Dialogue.
You're welcome.
With that being said, I've got another guest that's going to come on, another urologist, as we spoke about earlier, that's going to share with you some of the procedures and that you'll go through, from the biopsies to you name it, even the surgery. And matter of fact, he's the one who actually did my surgery. So stick around. There's more to come right here on District Dialogue. Welcome back to District Dialogue. Again, I'm Commissioner Henry Mitchell, District 1. And as I stated earlier, we're here at WellStar, and we're talking prostate cancer. Yes, it was an interesting journey for myself, and I have the opportunity to introduce to you, District Dialogue viewers, the gentleman who actually did the surgery for me and got me now to living a long, healthy life. So I'll let you introduce yourself as my special guest here on District Dialogue.
My name is Gaspar Msangi. I'm a urologist here at WellStar Douglas Hospital. I do general urology. I do a lot of robotic surgeries like the one I did for you. But I don't just do prostates, I also do kidneys, bladder surgery, and other techniques as well, open procedures, endoscopies for kidney stones or bladder stones. BPH is very prevalent in our community, and I help with that as well.
Well, let me first say thank you. And I know my family would say thank you for what you've done for us.
That was a privilege for me to be of service.
Okay, you got it. Well, let's dive right in, because I know you, as you can see, he's ready to go. But how do you know? How do you really know that this is a time that you definitely have prostate? So what are the signs? How do you get to that point of knowing that you got prostate cancer?
Unfortunately, for most people, prostate cancer has no signs or symptoms. It is something that you have to be screened for, and we find it through testing. I'm sure you had a conversation with the previous doctor about the timing of screening and things like that.
Yes.
But if we find an elevated PSA through a blood test, then we proceed with doing a biopsy. And this is a procedure that can be done either in the office or it can be done in a surgery center under anesthesia. I'm sure you went through it.
Yes.
And,
yes, I did.
For most people, it's a benign procedure, and people tolerate it very well. We take tissue samples from your prostate. We send them to a pathologist. They evaluate the tissue, and they give us a diagnosis. Wow. That's really the way to know that you have prostate cancer.
Got it.
Now, if the prostate cancer is advanced, it is possible for you to have symptoms, and the symptoms can be, now before I say the symptoms, I don't want to scare people because the symptoms are non-specific. You may have the symptoms because you have something else, and it may not be cancer at all, okay? Symptoms like difficulty urinating, blood in the urine, urgency, frequency of urination, those things are possible with prostate cancer. Or if it's advanced and you have metastasis to the bones, you could have pain in your hips, pain in your back because of the metastasis. But the majority of people do not show any symptoms when they're diagnosed with prostate cancer.
I'm one of those, right, exactly, because when we had this conversation, I didn't have any of those kind of signs other than you saying, let me explain this to you. And yes, you have prostate cancer. So that was because I was ready to run a marathon. I was like, you know, like this can't be true, or this is not, are you sure?
Right.
And I'm asking you that.
Right. So, I mean, so that's why it's very important for people to get screened for prostate cancer, because if you wait for symptoms, for the most part, if you're showing symptoms, the cancer is advanced. Most people are found to have cancer, at least in America.
So let's talk about the advanced. There's I'm gonna say 0, and then what, 4 or 5, and so.
Right. So most people are found when the cancer is still confined to the prostate.
Okay.
You know, you during your physical, you get screened for prostate cancer with a PSA. If the PSA is elevated, you get a biopsy. Most of the times if we find cancer, it's confined to the prostate. Meaning, if you had local treatment, then you could be cured of the cancer. Okay. Some people may have locally advanced cancer of the prostate, whereby the cancer has gone just right outside the prostate or involving the organs immediately surrounding the prostate. Okay, there's still possibility of...
That's an advanced stage of...
Yeah, it is a little bit advanced.
Okay.
It's not confined to the prostate anymore, but it's not disseminated into other organs far away from the prostate.
Got it.
So with that, it is also still possible to treat and cure the disease. Yeah.
Got it.
It could spread to other organs which are not immediately surrounding the prostate, like your bones. Usually, it could even go to the brain and other organs as well.
So, so the testing is important.
It is very important, yes.
And I know going through my process and with my physician doing the anal, and that may not be the proper word for this testing.
We call it a digital rectal exam.
Digital rectal, okay, all right. So with that, most men run away from that, but even then, she nor yourself could find anything from that because it was such an early stage.
Correct.
Because there was no lumps and bumps and there was no roughness, and I mean, share that.
So yes, when we do a digital rectal exam, what we're looking for is, first of all, the size of the prostate. We sweep our finger to make sure that the surface of the prostate feels smooth. It's not lumpy bumpy. It's not irregular, one side being larger than the other. It's not too firm. You know, things that will cue us to know that there's an abnormality going on. But like you said, you know, for a lot of people, a digital rectal exam is normal. It's negative, but they may still have cancer.
Correct.
So it's the rectal exam combined with a PSA that we use to screen for prostate cancer.
So there are some exams, as you stated, the rectal exam, that kind of you can catch it at that point, but if you're probably seeing it at that point, you could be further down the road.
It's possible, yes. Okay. You can have an abnormal exam and the cancer still be confined within the prostate.
Got it, got it.
But most prostate cancer that we pick up these days is through a PSA, more than a rectal exam.
So, and that's why we're encouraging folks to kind of do the PSA. And is that something that you request at your physician? You say you ask for a PSA, or is it automatic when you get a blood test at your physician? They test that? I'm not sure.
Ideally, it should not be automatic. Ideally, you should have a conversation with your physician before you do the testing. And the reason is, there are sometimes unnecessary testing that happens and unnecessary consequences that happen after the finding of an elevated PSA. There's many people who may have a slightly elevated PSA, and then they go through the anxiety of fearing that they may have cancer. They may have to go through biopsies of the prostate and then have a negative biopsy in the end. But they've gone through a procedure that may not have been necessary. So before you have the test, I think you should have a conversation with your physician saying that we recommend doing this, but these are the potential things that could come out of this test. So you have your eyes wide open, you're informed before you make the decision.
Makes sense. Let's talk about the surgery.
Okay.
So share with district dialogue audience about the surgery itself? I know now that they got the robotics.
Yes.
I mean, not saying they don't do the other ways of just cutting and digging, but talk about the surgery side of it, though.
Yeah, so the majority of surgery done in America for prostate cancer is robotic.
Oh, okay.
Prostatectomy.
Because we've advanced that much, I guess.
Correct.
Okay.
Traditionally, we used to do them open.
Okay.
And the whole prostate is taken out. There was a little bit longer hospital stay, and but now with advancement in technology, we can do very small incisions, like you know, and you spend a night in the hospital and go home the next day with a catheter. You come back a few days later, maybe a week or 2 weeks to have the catheter removed. I do not know what your experience was like.
Lord, let's not talk about the catheter. Jesus, but
for
go
most
ahead.
people, that's the most uncomfortable thing is the catheter.
Yes.
But it's not really, pain is not that big of an issue for a lot of people.
Right.
Everybody's different.
Right. But don't talk about the catheter.
the
We'll talk about everything else but the catheter. Because even with the catheter, and I don't mean to cut you off there, but even with the catheter with me, it somehow, my urine somehow got into the, blood got into the urine and it clogged it up.
Yes.
Well, guess what? I had to come back
and have the catheter
removed and replaced.
Yeah. That's rare. That's,
well, okay, thanks. I appreciate it.
Yes, things like that do happen.
Yeah.
But the surgery, robotic surgery has made things a lot better for patients.
Okay.
It's made a lot of things better for surgeons as well.
Okay.
It's easier for us to see with robotics. You get a 3D view of the anatomy.
Okay.
It's very clear. You know exactly where you're cutting. You know what you're pulling. You know what you're holding. Traditionally, there was a lot of feeling because deep in the pelvis, you can't really see.
Okay.
So there's a lot of feel. You know, you do by feel. But now I can actually see
it. Okay.
Yeah.
Okay.
So it's easier to tease out and preserve nerves, which will help with continence and erectile function after surgery.
So, as I'll call it my tailbone, you may call it something totally different because I don't have the medical terminology. So that's why when I'm sitting a lot, at that time, I couldn't sit a lot, which I'm still having difficulties with sitting. So I've got to get this cushion and everything else to sit down, and because of where the prostate was removed.
Correct. The prostate is deep in your pelvis, and sometimes people who have not had surgery, if you have prostatitis, you have a discomfort between your legs, and if you have surgery in the prostate, yes, you may have some discomfort with sitting, but usually that lessens over time.
Yes, it does. I'm getting better at it, but but as this long journey has been one of those, if I stand and sit, well, there's some time I couldn't stand because I feel like something is pulling down on me, or I'm sitting too long and it starts to irritate me. Kind of a combination of them both. Yeah. Yeah.
So different people have different symptoms after surgery, and these usually get better with time.
Yes. It's gotten a whole lot better.
Good.
A whole lot better. So
we're still early out of femur surgery.
I know.
Take the big picture. So you're doing well, I think.
I would say yes to that. I'm doing well. So the robotic now is the kind of the technology side of how things are and kind of give you recovery time faster. So WellStar is offering this type of a surgery for those who have it or need it. But what about for those who decide to take the chemo side of it or the radiation side of it? I mean.
So robotic surgery, radical prostatectomy is not the only treatment option for prostate cancer. You could have radiation therapy to cure the disease. That's done by radiation oncologists. And you go in, you have different sessions whereby they irradiate the prostate. I think it's an everyday session for about 30 days.
Yep. Sounds about right. Because it was brought to my attention about that, but go ahead. Yes.
Yeah, some people choose to have that because they don't want to have surgery. It may have less an effect on incontinence and erectile dysfunction afterwards. It's got its own side effects as well. Usually with radiation therapy, the negative effects may linger and become more evident as time goes out. Especially for us urologists, we see people who've had radiation therapy come back with irritative urinary symptoms. Urgency, frequency of urination, sometimes blood in the urine. And the blood in the urine can be very significant, needing procedures. But overall, people do very well with radiation therapy.
Got it.
So it is an option for cure. If you have prostate cancer that is still confined to the prostate, or even if it's a little bit locally advanced, you can still have radiation therapy, and it may be of benefit.
Got it.
Yeah.
Okay, and I know we're going to wrap this up though, but which option do you choose, or is based on you and kind of your vision as to what?
Yeah.
I mean,
So this, I usually have a conversation with my patients, and I also recommend for them to see a radiation oncologist in the appropriate setting.
You did.
There's some
check.
That's right. There's some patients who, actually, for most patients with locally advanced cancer, I will have them see a radiation oncologist so they can get education on both treatment modalities. There's some people that radiation therapy may not be appropriate, if they have advanced prostate cancer. Then I send them to a medical oncologist, and they'll discuss the options then. But it's a shared decision making, whereby I will advise my patients and I will tell them, I'll talk to them about surgery. Some people already come in with the decision that I never want to have surgery in my life, and I'm not going to have it.
Got it.
And I respect that, so I send them to a radiation oncologist.
Okay.
Some people are open to both options, and my job is to
But the better part of this
educate.
is to test and catch things like this early.
Exactly.
So you have the options.
Exactly, especially because prostate cancer, you may have prostate cancer and not have any symptoms.
Oh, I didn't have one.
Yeah.
Yeah.
So.
Because I was trying to get you to come and do the marathon with me until you said, sit down, let me explain this to you.
Hold on.
Yeah. So, but you're right. So the better part is to definitely get the testing done.
Yes.
Definitely, I would highly recommend that.
Yes.
To assure and consult with your physician.
Yes.
And kind of have that kind of dialogue.
Yes.
And now catching it early, hopefully that's what this result in, and that way you can kind of have the options of all of this that you can possibly do, and it's your choice. Because I know you said to me, well, Commissioner Mitchell, if you want, you can just kind of wait.
Exactly.
Sit
Not
and
all
wait.
prostate cancer has to be treated.
You're exactly right.
Yeah, okay. So that has to be a conversation with your physician, because depending on the pathology and your age and your medical condition, what other medical problems you have, and what your lifestyle is like, and what your philosophy about your life is. There's some prostate cancers we can just watch. Because the truth is, although we do diagnose a lot of prostate cancer, the majority of people who are diagnosed with prostate cancer will not die from it.
Got it.
Will die of something else.
Got it.
Okay, so
Get hit by a
that's
bus
very
or
important. Hopefully not, but yes, So it's very important for people to know that not all prostate cancer has to be treated. So people should not be afraid of screening and being found out, because information is power. Then you can decide what you want to do.
But you need to know.
You need to know.
Yeah. And then you can kind of get educated on what you may or may not want to do, though.
Right, because your prostate cancer may be that needs to be treated. There's some prostate cancers I will strongly suggest that you should get treated. Some we can say, we can watch it, see what happens, but there's some,
And also age plays a factor in this as well, though. So waiting to see in some time, and I'm not encouraging either way. You wait to see, and let's say hypothetically you're 75, 80.
Yeah. If an 80-year-old man is diagnosed with prostate cancer and it's Gleason 6, it's confined to the prostate, I'll probably consider telling him, you probably should see what happens.
Got it.
Okay. And there's different ways of doing that. There's active surveillance, whereby we are waiting, but we are doing something in the meantime. We're getting PSAs, we're doing exams, we're repeating biopsies, or we're just watchful waiting. We're just waiting to see if symptoms develop. And if symptoms develop, then we treat. But otherwise, if there's no symptoms, you're not suffering, you can live with prostate cancer.
Got it. Yes. And it depends upon how aggressive this...
Exactly right.
Whatever
the cancer is.
Yeah, the cancer is.
Yes.
Okay, wow.
Yeah, because even in those, in an 80-year-old who has prostate cancer, there's some that should be treated. If it's very aggressive, we can suggest treating.
You shared with me, from the mere fact of should you do surgery or chemo or whatever, or in the reverse, it's, okay, so help our audience understand, doing it in the reverse, it doesn't work best. I'm not saying it doesn't work best, but it's not recommended.
Yes, so if you've had radiation therapy, can you have surgery afterwards? You can. But once a tissue has been irradiated, it's not healthy anymore. It's not as easy to work with surgically. There's a higher risk for complications compared to fresh tissue that has not had radiation therapy.
So that's why the surgery would be recommended before type of radiation
Typically,
versus
yes.
in the reverse.
But you can have either way.
Got it.
Yes. And so there's surgery, there's radiation therapy,
Mm-hmm.
but there's also hormonal therapy, which is a treatment option. There's cryotherapy, and there's proton therapy. There's many different options for prostate cancer.
Understood.
Yes.
Okay, thank you. I appreciate it. I really, truly appreciate this.
It's been a pleasure.
Is there anything else that you would like to share with our District Dialogue audience about what you do, how you do, and being a great part of WellStar? And thank you for being a part of WellStar. But I mean, just anything you'd like to share, because this is going to be a mission of mine now, as you probably know, that I'll take this journey and we're going to go a long way with it in making people aware, especially men, about this particular disease.
It's important for people to have regular medical checkups.
Okay.
There's a lot of people that I meet that feel healthy and they don't go to a doctor because they feel healthy. Yes, you should maintain that health. There's a lot of people who take better care of their cars. They go have their oil changed every 3 months or however long, but they never go every year to have them checked.
Right.
They should.
Right.
And you can find that you need to check your blood pressure and maintain it, and have a PSA checked if you're between the ages of 55 and 69. Talk to your doctor about all these things, because it could change your life.
Yes.
For the better.
Yes.
Yes.
Well, thank you. Thank you for that closing word. We really appreciate it. And for those of you that are watching, thank you for being a part of my journey and the journey of understanding more about prostate cancer. Thank you again. Enjoy your day, and thank you for tuning in to District Dialogue. I'm Commissioner Mitchell.